Rosemary is an author, a public interest advocate, and she's been writing about patient harm and overuse of healthcare for many years, and really has been a leader in the consumer and public interest community in pushing for attention to the issues of overtreatment and overuse.
I want to take a moment to reflect on what's been accomplished over the past 10 years and how extraordinary it is. The second thing I want to do is talk about some of the challenges we face going ahead. And third and finally, I want to take a few moments to reflect, some personal reflections on some of the extraordinary people that are part of all that's happened so far. I know you can't read this, but this is an email I got from Jim Guest. It was in July 2003, announcing his excitement that Consumers Union got together and said, we want to start something around patient advocacy for patient safety. And I think it said something around infections. And so to me, it was like a line in the sand, and I keep this as a memento of how this movement really took off. And we're so grateful to Lisa, Daniela, and Suzanne for making it possible. I was thinking before coming here about what we've really accomplished, what you've accomplished. And I remember reading a paper by Dr. Stephen Miles at the University of Minnesota. He's a physician and ethicist. And he said, he had gone back and looked at translations of the ancient Greek medical texts. And he said, even at that time, physicians noted, there were medical errors that were noted. But nowhere was there any indication that the patients or the families were apprised of those bad outcomes. And so what's been going on that we have been discovering individually and collectively has been going on for thousands of years. So let's give just that historical context of what it is we're trying to change. That's just a little rendition from Wikipedia on the physician and patient from ancient Greece. What have we accomplished? I ask my husband that all the time, so you write Wall of Silence, what the heck happened? And he said, I'm going to ask you this question with a show of hands. How many of you think that people are alive today because of the work that you and we have done? We should take a moment and reflect on that. That people are alive today because of what you and we have done. We are waking people up and forcing them to go look at things that throughout medicine they've never wanted to go look at. I call that the gift of realization that we're giving people. And that's a great gift. And good people are waking up, and there are those who will never wake up, maybe at their last breath, or like that tobacco lobbyist who got cancer, lung cancer, and was looking at through the oncology ward and said, I probably put some people here. So that moment of awakening will come at some point. I want to acknowledge the role of journalists. I'm glad that Peter's here, and maybe the others, Charlie and Marshall. This is my favorite example of the role of activism and journalism. This is a photograph from the Gandhi movie. Obviously Gandhi, and the person on the left is Martin Sheehan, who's playing a New York Times reporter. In the film, his name was Vince Walker. His real name was Webb Miller. And Gandhi was a shrewd strategist, and he was holding a nonviolent protest in India. The British wouldn't let the Indians make their own salt. Think of it in a country like India. And so there was a nonviolent protest, and he invited this New York Times reporter, Webb Miller, come over to watch. And in the film, it's so extraordinarily moving. You have lines and rows of people lining up in nonviolent protest, and the British soldiers on horses come and they beat them one by one, and they fall to the ground. And another row comes up, and the British soldiers beat them, and they fall to the ground. And another row comes up, and another row. And as the New York Times reporter said in his verbal reporting, he said, it went on and on into the night. The moral ascendancy of the West has been lost here today. And I think about the moral ascendancy of medicine and how it's been so deflated. And this reporter was instrumental in his reporting in the New York Times. This reporter was instrumental in changing public opinion in the Western world about the too big to fail British Empire. And it failed. And as Gandhi said to the British, someday you'll just walk out, and that's what they did. So this extraordinary role of what Consumers Union has done with a partnership with public interest journalism is so extraordinary. We need each other. It's that symbiotic relationship. And together, we are taking on something that seems too big to fail. Where are we headed? I borrowed the next two slides from Dr. Terry Fairbanks, who's an emergency room physician and a human factors expert. And it was just convenient, since I'm not that creative in putting a slide together like this, but we need to have Dr. John James's rates added to this. But this is just where we are with adverse events rates in healthcare. And then we have this one. And on the right-hand side, we have ultra-safe industries like nuclear power and commercial aviation, which is good if you're flying home today or tomorrow. And on the left-hand side, we have dangerous healthcare. So we have this. This is the current status. This is a status quo. Then we have another phenomena that's coming on top of this. It already has emerged. And that's the thing called high productivity demands in healthcare. So here we have a defect-ridden system. And I want to thank Helen Haskell, who taught me, was the first person to open my eyes to overuse. When you said, Helen, we were talking about Lewis's story that I wrote about in Wall of Silence, and then you said, well, then there's the other story. And I said, what's that? Well, should he ever have had that surgery to begin with? And so we have this phenomena of overtreatment. And that overtreatment, and the title of the session is Bill, Baby, Bill. The mantra in healthcare today is volume, 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 volume. And we're making the system run faster, faster, faster. Again, a defect-ridden system that's required to run faster. I played this Chocolate Factory video. I don't have the, perhaps Suzanne could get it for us, but in the interest of time. I showed this to a group of healthcare people. Marshall was there, the National Quality Colloquium. And you remember this? This is when the chocolates are coming along the conveyor belt and they speed it up. And Ethel and Lucy are putting them in their pockets and stuffing them under their hats. And with chocolates, it's fine. And when the boss came in, they said, oh, everything's fine. And so let's just go it faster. And I show this in healthcare because this is what's happening in healthcare. And people laughed. Not because they thought it was funny, but because, the film is funny, but because they know this is what's happening in healthcare. So where are we headed? We have a defect-ridden system, and we're asking people to do more so we can bill more. In the oil industry, it's drill, baby, drill. In healthcare, it's bill, baby, bill. I'm going to tell you this. This is an email I got from a wonderful nurse who's on the inside. She's a consultant. She doesn't work there as a bedside nurse. And so she's able to speak truth to power. And I know you can't read this, so I'm going to read it for you. I have to tell you this story from yesterday. I was brought into a very large 6,000 employee hospital to assess the culture. The cardiac surgeons will do surgery on anyone who moves. A total heart transplant in 360 days in the hospital for a patient that never passed the psych evaluation and who died because he stopped taking his medications. After meeting with the CEO, I was told that, quote, I upset him greatly with my comments that they were doing unethical and immoral surgeries. When we met again, he was visibly shaken, with his head in his hands, and, quote, feeling ill. So much of what goes on travels just under the level of awareness. It was painful to witness. There was that moment of awakening. And our job is to have more of those moments of awakening and keeping them awake. So they're in their conscience. There's error and then there's atrocity. There's error and there's evil. Our job is to wake them up. That's why I wrote The Treatment Trap. And it's not just the harm from overuse, but the fact that we're clogging up the system with all these things that don't need to be done. That in itself is causing the error rate to go up. And so when people say why we're doing all this and why it's getting more unsafe, because it's not a static system, we're just jamming more things to make more money. And then there's a third layer here, and that's the business of healthcare and the unforgiving demands from investors for ever-increasing returns on capital. It's a lot easier to make money in the United States on healthcare, it's like taking candy from a baby, than it is to set up a legitimate business and compete with China. And so we take the easy route. And so all that money's flowing into healthcare, and guess what? They want a return. And it's not like the days when my mother worked at AT&T and they held on their stock for 40 years. Nowadays, stocks are held for, 3 months? Because you have these high-frequency traders that just want pennies and they keep trolling. And these companies, drug companies, device manufacturers, the things I've learned from Kim and now from David, that's the underlying. I call it, we've got that. And as Eileen Carina knows from Long Island, I grew up there and went to the beach on Jones Beach. And I remember the undertow. How many of you ever swam with an undertow? It's invisible, isn't it? But it's a very powerful force. And I think the business forces are like an undertow. That's the other factor driving it. And so we have this. We have price bubbles now in healthcare. We have toxic assets. I learned from David about the Da Vinci robot. I learned from Kim about antidepressants. All these products that we're putting out there in surgeries that are the equivalent of toxic assets, done by companies that are too big to fail. For now. We've socialized losses and privatized the gains. So all that we're talking about, that's all socialized losses. We are paying for it in human terms and financial terms. And one of my missions is to help people understand the business behind it so that we can participate in our democracy more effectively. Here are the 7 habits of a highly entitled healthcare industry. And I'm grateful to my colleagues on the Consumers Union Safe Patient Project listserv because you helped inspire a compilation of these. It wastes money. It tolerates poor performance. It resists scrutiny. It has reputational immunity. Silences critics. We have that right here, right now, going on in Maine. Breeds corruption and seeks protection from the political elite. I wrote about that here and explained the manifestations of the sense of entitlement. When I was on Capitol Hill last month, I said to 9 members of Congress who were sitting around a conference table bored during the shutdown, I said, seniors' entitlement to Medicare is not what's driving it over the fiscal cliff. The healthcare industry's sense of entitlement to Medicare is money, that's the problem. And yet on both sides, they just want to keep taking and taking more money to feed the beast. And unless we wake up, there won't be enough money to plow the snows and winter in Maine and send our kids to school. So how do we manage that bigness? How do we live with it and not be depressed by it? How do we find resilience and keep going forward? I'm so grateful to Lisa McGiffert. As I said to Lisa this morning, one of the things you taught me, Lisa, was you are persistent. You don't give up. You keep going and going and going, and you find a way over the brick wall. You taught me that. And then there's a wise person who once said, seek not what you want, but what you already have. And what we have, even in the face of big challenges, We should never underestimate it. We have a power and a passion, and we're smart. And we got to keep going and going and going. The sea is so big and my boat is so small. It gets lonely, so we do this. And we become a force. And we keep growing and growing. I remember, Eileen, where's Eileen? I remember Googling, this is how I got started. I Googled medical error victim, and what popped up was a church on Long Island in the town next to the one where I grew up. My mother still lived there. And I called up the pastor, and they said, you've got to talk to Eileen Karina. And then the flotilla started building. And she connected me to Helen, and the rest is history. And look how much we will grow, and we will continue to grow. And the reason it's going to be inevitable, the growth, is because powerful people are also being heard. And they will wake up. And someday I hope they'll use any of their money to fund a patient advocacy movement. I call it really a patient advocacy leadership movement. You know, I want to take just a couple minutes on a personal note, how much all of you mean so much to me. And I won't get to everybody, and for those of you who are not part of the Safe Patient Project, you should have some glimpse of the kind of people that you're sitting next to in this room. These are extraordinary people. Helen, you are an archaeologist, and you've used those skills of keep digging and digging and digging. Helen started Mothers Against Medical Error, Maine. And today, Lewis he'd be 28 years old. This is the 13th anniversary of his death, and we remember him today. Kathy, you are like the Rock of Gibraltar up in Maine. You get awards, you speak out, you help patients who've been harmed, they come to you. And yes, you get a cease and desist letter from the hospital. But we hope and we know that your efforts at patient safety will not cease, nor will they desist. Thank you for that. It's not easy. Dee Dee, you are amazing. I'll never forget when I met Dee Dee Valier from Hood River, Oregon. We were on the phone. We had only met by phone. And I'll never forget the time you told me that you had gone to take an online course at the University of Wisconsin while your husband was in the hospital to find out what this infection business was all about. And you had to tell the doctors how to treat him. And you used that experience to turn it into a powerhouse of public reporting, and they've kept you there. And I think they keep you there because they know. Deep down, a lot of people know. Some don't know. And Kim, you are the supernova that lightens up the sky. You lightened up the front page of the Star Tribune in Minneapolis over the weekend. And you bring people together from all walks of life to say we should stop selling sickness. And we need to help Kim because she needs a planning committee to plan for the next one. And we need to help her fundraise and to grow the community. We've got to move out beyond ourselves to grow this. And David, I just met you yesterday, and you are a tour de force. I'm so glad to have an Air Force pilot on board this journey. I'm sure you didn't want to be on this flight. But boy, now that you're on, I'm so glad that you're here. And Yanglin, you are so smart. In your quiet way, you are so extraordinary. Alicia, I said to you today, you're full of grace and elegance. Despite it all, you went through it, and you are full of grace. Where's Dan Walter? Dan, you are amazing. You got to read Dan's book, Collateral Damage. And what was so impressive about Dan's book is your wife is a nurse, worked at Johns Hopkins, right? And what Dan did that opened my eyes was he was also the archaeologist. You went deep. and you connected the dots of the industry and the doctors and how it all ends up to patient harm. That's incredible. John James, NASA toxicologist, soon to be replanted and repotted. And I can't wait to see what you're going to do. I'm sure you can't wait to see what you're going to do. It's just an open palette for you. And you did that article in the Journal of Patient Safety. They published it. John is the one that did the study that's raised the estimates on how many people were really killing in America. And you had peer reviewers look at it. And they said, sure, go ahead. And isn't it amazing that we rely on grieving parents to be the ones that count the number of deaths from a leading cause of mortality in the United States? That's outrageous. But we'll keep going. And we'll keep doing it. And Mary Ellen, you brighten up that listserv when we go offline and you show me the flowers blooming in your garden. It reminds us that there's a lot more to life. And Lisa and Pat and everybody. And Jean, you are like wine that gets better and better and better as you keep going. I'm sorry I'm missing some people, forgive me, but in the interest of time. Lisa and Daniela, you've brought these dinosaurs, including, where's Daniela? You've brought this dinosaur into social media for social change. And you had this passion for justice. I was looking on your Facebook page while I was on the train yesterday. You really have this passion for justice. Thank you. And Suzanne, we have very high expectations of you with this warranty business. You go for it. So I will stop there and thank you all from the bottom of my heart for all you do every day, quietly, without fanfare, to make healthcare better and safer for us all. Thank you. I forgot this quote that I saw from Nelson Mandela, and I thought of all of you. He wrote this to from prison to a longtime advocate in his cause. And he said, "The ideals we cherish, our fondest dreams and fervent hopes, may not be realized in our lifetime. That's beside the point. The knowledge that you did your duty is in itself a rewarding experience and a magnificent achievement. Seek not what you want, but what you already have and what you've already done." Thank you.